This handout is found on the website. If you scroll down to the bottom of all that stuff that's posted under other documents, you will see the brain, cranial nerve, lumbar plexus handout. That's where this is from. Okay, in this section we're going to look at, let me give you a quick teaser here. As you can see, there's a bunch of nerve plexus and nerve distribution patterns and so forth. So we're going to be looking at all that. All right, so let's start in the brain. This is an anterior view, cross-section of the brain. You can see projection fibers coming up as they decussate and cross over to the creating the association fibers. Okay, the corpus callosum, which is the orange that you're seeing here, these are the commissural fissures that help connect the right and left hemispheres. Okay, and then in the pyramids, you're seeing the decussation, the crossover. So right body to left brain, left body to right brain. All right, the association fibers connects the area of the cerebral cortex within the same hemisphere. The commissural fibers connect from hemisphere to hemisphere, and the projection fibers connect cerebrum to other parts of the brain and spinal cord. In males, the projection fibers are increased in number. That's what gives them the ability to be more compartmentalized and focus on one thing at a time. And in females, they have a higher concentration of wiring in their commissural fissures via the corpus callosum. And this is what gives women the ability to multitask. Now, that's not to say men can't multitask and women cannot focus on one thing at a time, but overall, in general, your bell curve stuff, women really good at multitasking, men really good at focusing on one thing at a time. Okay, on this next one, it's showing, let me get that rotated. The cerebrospinal fluid circulation. Now, this is something I've already covered in a prior lecture. Okay, here is the sympathetics. Sympathetic nervous system is found T1 to L2. This is where those fibers are found, and you can see all those fibers here. They come off the spine. So these are the pre-ganglionic neurons. This is the sympathetic chain ganglion, and these are the post-sympathetic fibers, or post-ganglionic neurons. When you are in sympathetics, which is your fight or flight, this is the area that is being recruited. Parasympathetics are craniosacral. Those are the nerves that come out of the cranial area and innervate everything in your body, and come out of the sacrum area and innervate everything in your body. Now, I covered this on a prior lecture. Okay, as far as the neurotransmitters, the sympathetic nervous system, so here's your sympathetics, the pre-ganglionic fibers release acetylcholine. The post release epinephrine, norepinephrine. This is what puts you in sympathetics. The parasympathetic division, the pre-fibers, so parasympathetics, the pre-fibers, which are very long compared to the sympathetics, which those pre-fibers are short. The parasympathetics release acetylcholine and enable synapse on the post, which also releases acetylcholine, which will synapse on the tissue, putting you in parasympathetics, which is rest and digest. Okay, here we're looking at C3, C4, C5. Together, these make the phrenic nerve. C3, C4, C5 keeps the diaphragm alive. That is phrenic nerve. or the three come together to make the phrenic nerve. Okay, so please know that. Okay, on this one, we're going to look at the brachial plexus, which is C5 through T1. The brachial plexus, C5 through T1. And so you're seeing it here. There's 5 all the way down to T1. Okay. All right, so C5, C6, C7, C8. This one's a little tricky. C8, because we only have 7 cervical bones, but we have 8 cervical nerve roots. And then over here we have AKAs. All right. So C5 and axillary nerve go together. C6 and part of radial nerve go together. C7 and radial nerve, and part of musculocutaneous. And then C8, now we're getting into median nerve and T1 ulnar. So it is a little confusing because there's some overlap. You have the nerve root itself named after the level it comes out of. C5, C6, C7, C8, T1. Once it gets out into the periphery, then it changes names into an actual name. Okay. Now in the slides below, we'll look at those specific names, but I want you to see the whole plexus where we have the nerve root name, simply named after the level and number, and the peripheral name, which is a full name. All right, axillary nerve comes out of the neck, so C5 area, and eventually turns, so C5 comes out, eventually turns into axillary nerve, which innervates deltoid area. Okay, so you're going to muscle test the deltoid and sensory test the deltoid area. Now you'll notice I have written here pinwheel and Q-tip. So you take a pinwheel, which these are also some videos I'll post as well, so make sure you look for that. A pinwheel is a spiky wheel, and you simply run that over the skin on both sides. Does this feel the same as this? And then you follow up with the Q-tip, which is a soft tip. So this elicits the pain and temperature fibers. This one elicits the tactile fibers, or non-pain, non-temperature fibers. So pinwheel, does this feel the same as this over that area? Q-tip, does this feel the same as this over the same area? That specific area, C5, axillary nerve. The muscle test, you have them raise their arm because that contracts the deltoid, push down. Can they do it? Muscle testing. Okay, radial nerve. Now this is a posterior view. This is the back of the arm, back of the hand. The radial nerve is basically all the extensor muscles. Tricep extension, wrist extension. So muscle test the extensor muscles, tricep and extensors. So that's your muscle testing. The sensory is this area in yellow that you see. So you take your pinwheel. Does this feel the same as this on both sides over that area on the posterior arm? And then take your Q-tip. Does this feel the same as this? Okay, ulnar nerve. The C8-T1 area, nerve root, branches out into the ulnar nerve. This, by the way, is your funny bone area. So when you strike that area, it sends that zinger down to your pinky and ring finger. It's not so funny, but that's our so-called funny bone. what you've actually done is hit the ulnar nerve. Now look at this. The sensory is pinky and part of your ring finger. Pinky and part of your ring finger. So if someone comes in pointing to their ring finger and pinky, and they go, it's so weird, like it's numb and tingly or whatever. I have a weird sensation here. In your mind, you're thinking, oh, that's ulnar nerve, or in the neck, there may be something going on in your neck at the C8T1 area, causing ulnar nerve distribution issues. Okay, so muscle testing, you have them spread their fingers and resist the spread of the fingers. So like open the hand and you're trying to squeeze the fingers together. Can they resist that? And then sensory is back to Q-tip and pinwheel over those areas. Pinky on both. Does this feel the same as this? Okay, the median nerve, this is our classic carpal tunnel syndrome nerve. So if a person has carpal tunnel syndrome, likely median nerve is pissed. So median nerve comes out of the cord, out of your neck, goes down to thumb, first finger, middle finger. Okay, so this is C6, nerve root in the neck. So it comes out, goes down the arm, turns into median nerve, goes under the flexor retinaculum and through the carpal bones in that carpal tunnel area and innervates thumb, first finger, middle finger. In more professional terms, digit 1, digit 2, digit 3. So Tunnell's test is you take a reflex hammer and you strike the median nerve several times. If it's inflamed, it will send zingers down to the fingers. That's one of the tests you can do to look for carpal tunnel syndrome stuff and or an inflamed median nerve. There's another test called Phelan's nerve, and that's basically making the arms or the hands go into extreme extension and extreme flexion, and you're trying to piss off the median nerve by doing that. So at the wrist, extreme extension followed by extreme flexion, and what you're trying to do is kink that median nerve to see if it's positive. Anyway, those are some orthopedic tests you can do to assess where is the median nerve entrapment. Is the entrapment at the wrist, at the elbow, at the axillary, or in the neck? Because anywhere in that kinetic chain it can be hurt, causing carpal tunnel syndrome stuff. Okay, so sensory, pinwheel, and Q-tip over those areas of the hand. Does this feel the same as this? Meaning comparing the right side to the left side. So you're on the right side. Does this feel the same as this? And they'll tell you, I cannot feel it on my right side. Like when you did it over my thumb and first finger, couldn't feel it. Okay, but I felt it on the left side. Now keep in mind, in that example, that means that person came in with, the right fingers being symptomatic. And so now you're just testing for it. Muscle testing is... you can have them open the fingers. You can have them do bicep. So also part of this is bicep. C6. See if they can do it. Just muscle test the bicep. Okay, getting into the low back. Okay, so now we're in the lumbar plexus. You're seeing the common fibular nerve, also known as the common peroneal nerve, plus the tibial nerve makes the sciatic nerve. Okay, so know that. The common peroneal nerve, which comes out of your low back, look at this, L5, S1, S2, all these come out of your low back area. So this is the nerve root. As it comes out, it turns into the peripheral nerve. The common peroneal nerve plus the tibial nerve come together to make the sciatic nerve, which goes all the way down to your foot. Okay, the obturator nerve, which comes from L4, nerve root, turns into obturator nerve, innervates your adductor muscles, adduction. So the muscle test for those. The sensory is this area. Q-tip does this, feel the same as this. Pinwheel does this, feel the same as this. Doing the right side and the left side. The femoral nerve, which is also L4 nerve root area, comes down and innervates the quad muscles, overall quad muscles. So you'll muscle test the quad, have them resist you contracting their quad. The sensory is this distribution pattern here. Basically quad and over the patellar area. So sensory, pinwheel does this, feel the same as this, and Q-tip does this, feel the same as this, as you're doing right side, left side. Okay, on this one you can also strike the patellar tendon to elicit a reflex, which will be assessing the L4, L5 nerve root. Okay, the tibial nerve goes to the back side of the leg, so posterior leg. And plantar flexion is pointing your foot, pointing your toes type stuff. Okay, so the muscle test is plantar flexion, or you can just have them go on their tippy toes. Okay, so lower nerve roots, S2, S3, tibial nerve. And then it goes down the back of the leg. Sensory is basically the calf area, the gastrocnemius area. Then there's a side. Or you could have them. So sensory pinwheel, does this feel the same as this? Comparing right to left. Okay. Fibular nerve. Okay, the fibular nerve comes out S2, S1, S2, and goes all the way down. Now, if you look at the anterior and lateral view, this is more fibular nerve area. Just think of where the fibular bone is. So that lateral leg part. Okay. This one you're going to do Achilles reflex. And so that means you're going to strike the Achilles tendon with your reflex hammer to see if you elicit a reflex response. So that's a test you can do. Sensory would be pinwheel and Q-tip over basically the fibular bone area. Does this feel the same as this? And then you're also looking for muscle testing, which is heel walk. So you have them lift their toes up, so dorsiflexion, and lift their toes up and walk on their heels. Okay, so that would be assessing for muscle testing.